Hello viewers, this is Dr. Grace. I'll be presenting to you this wonderful topic, how to prevent gestational diabetes during pregnancy. And if you're new to the channel, please, I do encourage you to subscribe, comment, and share with family and friends. What is gestational diabetes? As simply stated, it is diabetes that are developed during pregnancy, and to those that are affected, it usually starts around the beginning of the third trimester. But most remarkable here is that blood glucose levels often return to usual levels after delivery. But the reason why it is key to learn about this condition is due to the complications that may develop to the mother and the baby, as will be discussed soon. So, regarding the possible complications of gestational diabetes, the baby may experience high birth weight, or what they normally refer to as an extra large baby. This is because the baby is overfed and grows extra large, which could cause discomfort to the mother during the last month of pregnancy. And then the baby may also be born early. So in this case, you may experience a baby delivery before the maturation of 9 months. And the baby may also experience low blood sugar levels. And later in life, the baby may also experience type 2 diabetes, which is not ideal. And to the mother, she may experience high blood pressure and a possibility of pre-eclampsia. For pre-eclampsia, this is when high blood pressure is combined with protein in high urine and often swelling in fingers and toes that doesn't go away. In this case, since it's a serious problem, it needs to be watched closely and managed by her doctor, because it could cause harm to both the mother and her unborn baby. And gestational diabetes may also lead to C-section, or what others refer to as cesarean section. And this is where an operation is done to deliver the baby through the mother's belly. And for the mother also may experience type 2 diabetes after delivery, or may experience gestational diabetes in future pregnancies. So can it be prevented? There are some things that can be done to prevent gestational diabetes. First and foremost is maintaining a healthy weight before and during pregnancy. The reason why I say this is because obesity is a big contributor to gestational diabetes. But for this to be done, it can only be achieved via lifestyle modifications, by eating a balanced diet and getting regular exercise. And secondly, women should monitor their blood sugar level throughout pregnancy. Currently, the guidelines recommend using a standard blood glucose monitor, since there is limited evidence of using continuous glucose monitors in pregnant women. But if the blood sugar starts to get too high, then they should talk to their doctor about ways to bring them down. And for the testing frequency, the standard recommendation is checking 4 times daily, but this can be reduced to 2 times a day if patient is well managed with lifestyle changes alone after a few weeks. And for those not aware, the goals for diabetes in a pregnancy, if somebody is fasting, their blood glucose level should be 95 milligram per deciliter or less. And for 1 hour after a meal, should be 140 milligram per deciliter or less. And 2 hours after meal should be 120 milligram per deciliter or less. So that's how it's best to go about preventing additional complications from this condition. How is gestational diabetes treated? The first recommendation is insulin, which is known to help keep our blood sugar levels under control, and is known to have the longest track record and easier to fine-tune as pregnancy progresses. But even while using insulin, it's still important to maintain a healthy diet and exercise. After the baby is born, there is need to emphasize follow-up. And the reason why this is crucial is because gestational diabetes is a serious condition that can have long-term consequences for the mom and the child. And in this follow-up, it's possible for the healthcare provider to identify and manage possible prediabetes, type 2 diabetes, cardiovascular risk, just to name the list. And for any mom that is diagnosed with gestational diabetes, they should work with their healthcare provider to develop a treatment plan. So hope you enjoyed the presentation, and don't forget to subscribe, share, and turn on the notification. Goodbye for now.